For those who just joined us, thank you so much for being part of the TAP meeting. And please put your name and the agency you're with on the chat box. And thank you for everybody that has already done so. With that, I'll send it back to you, Didi.
Thank you, Ezekias. Before we call on our first presenter, I would like to start off with, excuse me, today on our agenda, we will have Valley Metro updates. Updates from the City of Phoenix has our designated recipient for Section 310. And we have an agency spotlight by Ability 360, a presentation by a great resource group called Disability Resource Connection. I will provide a couple of regional human services transportation updates, and we will have some updates from our sub-regional mobility managers. But before we bring on our first presenter, I would like to start off with a polling question to give all of our presenters an idea of who we have in our audience today. So the first polling question is, what type of organization are you representing? Are you a government agency, a municipality, a nonprofit agency, private for-profit, a citizen, or other? And I will give you some time to answer that question. You're almost there. Okay. And the type of organization that you're representing, 82% of you to here today are from nonprofit agencies, and welcome. We have 14% government agencies, and then we also have municipalities attending. So thank you everybody for your time here today. So moving on to our first agenda item, I would like to welcome Guillermo Gonzalez, who is the Valley Metro Program Coordinator for Accessible Transportation Services. And public transportation is a great resource for our stakeholders here today. If it's available, if it's appropriate, and it's accessible for your consumers. We're really happy to have Valley Metro has a really strong partner with us. And I would like to now welcome Guillermo for your presentation. Thank you.
Thank you, Didi. Can everybody hear me okay?
I can.
Okay, perfect. Let me just go ahead and I need to be able to share my screen. Perfect. Alrighty, we have a couple of Valley Metro updates. Again, my name is Guillermo Gonzalez. I'm a program supervisor. My main role in Valley Metro is to supervise the eligibility and travel training contract, along with marketing and various media edits for the Accessible Transit Services Department. Trevor Ebersol is also my partner as well. He is the Paratransit and Ride Choice Program Coordinator or Supervisor. However, he is stuck in another meeting. He will be joining us a little bit later. Maybe next TAP meeting, I'll be able to introduce him formally to everybody. Alrighty, so just gonna go ahead and start with ridership. As you can see, our bus ridership does always tend to go a little down in the summer, but it is pretty much leveling off here in the summer. Light rail the same. The heat really prevents people from getting out there. We do have a new train out there called Streetcar. I don't know if any of you have had the opportunity to go in Tempe, but Streetcar does connect to the light rail as well as other local buses in Tempe, helping students get around that area and Tempe residents get along that area as well by ASU. Our paratransit numbers are pretty leveled off, as you can see. Again, ridership does go down a little bit in the hotter months. And ride choice as well is leveling off as well. So we are seeing this leveling off after the COVID. And then there are some changes going on. Right now, October changes are coming up, October 24th. I do want to let everybody know, again, there is no physical transit book anymore. There is only an online book. There is our Valley Metro application, which allows you to plan a trip. You could also go on Google to plan a trip. And if you wanted to call our customer service, they'll be able to give you the various times. Also, you'd be able to print out they'll be able to print out a schedule and mail it to you if you need one. So just those changes are going into effect on October 24th. So we'll have new service there. In April, the proposed changes are coming up. The comment period is going to be from November 1st to December 4th. These service changes are to take effect on April 24th. So there will be a comment period. There will be a public hearing regarding all of this. So you'll be able to comment on the various changes that are going to be there. You'll be able to find out on Valley Metro webpage at valleymetro.org service changes. So just going into a couple of our projects, I don't know if any of you have noticed, but we do have a little bit of construction going on in a lot of places right now. So starting off in the Northwest Extension, this Northwest Extension area is an area that is going from the end of the rail station over by Dunlap, and it's going to go up Dunlap, up 25th Avenue, and then turn left on Mountain View Road. It's going to go over I-17 and it's going to connect, and we're going to have an elevated train station at Metro Center. So all of the trout work has been done. The utility relocation is supposed to be finished by the end of October. So it's pretty exciting. The bridge construction on 25th Avenue, it should be completed through 2023. So we are working, and it is coming to fruition. I've got a couple pictures here to show you. As you can see here, the support structures that were installed on 25th Avenue and Dunlap Station. This is where it starts to go up. This is the actual station itself. They're building the stairs and everything. There's going to be a mural on the stairs. So as you walk up, looking at the stairs forward, you'll be able to see a beautiful mural. Not exactly quite sure what it's going to be yet. And here is the bridge itself that goes over I-17. As you can see, there's the rail. Now going over to another project, the South Central Extension and the Downtown Hub, we are 50% done. Yay! The crews are finishing a lot of the special trout work over the summer. So it's been round the clock building on there. There's been a lot of traffic deviation, as well as bus stops that have had to move to different locations. And we've been working tirelessly every time to make sure that the public knows where they are going to be dropped off, or where they can pick up a bus or a train. The track at some stations, the installation is still continuing in downtown. As you can see here, the track has been installed and some platforms are being built. And there is now a bridge that connects Cityscape. I apologize. That connects Cityscape there. So customers are going to be able to walk right across and then come back down, so they don't have to go completely to the corners to cross the streets. So that'll be convenient for the businesses, as well as customers trying to get to and from. Here's another overview of here on Washington Street and First Avenue. They are still laying a lot of train. There's a lot of construction going on, so that's going to be another platform there. And here is this is the 3rd Street and Jefferson area. That is basically complete, so that looks pretty sharp to me. So this the South Central Extension is going to go pretty far down. As you can see, we are going to need a reinforced bridge. So they are working there to make sure that it can carry the weight of the trains crossing. And I wanted to go a little bit over this Valley Metro update. We have an application, and starting in December-ish, January-ish, we're going to have mobile ticketing available. So we've had over 140,000 downloads since September of 22. And then over 50% are registered with the emails ahead of mobile fare. If you want to do mobile fare, you need to register in order to purchase mobile fare. So you won't have to carry a ticket or anything like that. You'll be able to just use your phone on both Droid and Apple platforms. Mobile fare is in the preliminary testing, and mobile fare public pilot is now recruiting in November, and December testing dates are subject to change. And I just kind of wanted to give you a little brief overview. As you can see, you'll be able to purchase various tickets, and then you'll be able to have them in your wallet and then be able to use them when you need to with the scanners. That's an active ticket right there. You'll be able to scan that, and that'll be active. If you don't have that QR code, that means it's still not an active ticket. So that'll be pretty exciting. This should be up and running before the Super Bowl. And fare technology modernization. We are changing our fare technology. So all of our ticket vending machines, our fare readers on both rail and our buses are changing. There are a few phases that are going out. Right now, the fare reader installations are happening, and then the new fare vending machines are scheduled to be installed in 2023. All the new fare boxes are scheduled to be in 2024. Now, the fare vending machines are going to be located at various transit stations and light rail stations. And then the fare boxes are going to be located on all the buses. And then coming brand new to our service are going to be reloadable fare cards. So you're going to have an actual card, like a debit card, that you're going to be able to reload, and you're going to be able to use repeatedly throughout the day. And what it has, it's going to be able to credit you throughout the month. So if you reach the cost of that 31-day pass, you don't have to pay anymore. So it's going to accumulate that through that month. And that'll really help our frequent riders. So they'll be able to just go ahead and do that, and then they just have to stop paying after that moment. And the smart card will already take care of all of that. There's going to be reduced fare on there as well, and then also the premium fares that we have for commuters. You can learn more about this fare technology on our website at valleymetro.org fare technology, /fare technology. You'll be able to look in more detail at the timeline, the different phases, and what should be coming. And it also has contacts for you to be able to reach out if you have any other questions regarding this new fare modernization. And I did want to talk again about Valley Metro's Accessibility Advisory Group. We are still recruiting. Right now, we are having our next meeting in November. And what does it do? We want to make sure that we give the ability to the public to learn about the accessibility of our services. This doesn't only include people with disabilities. This includes regular riders that use maybe the commuter service. We want to make sure that we target all systems. So the trips that go to downtown, the premium service, as well as regular, as well as local, as well as light rail, the new streetcar, paratransit, ride choice, people that use our app, people that help others register for or make appointments. We want to hear from you and let you know what accessibility we have. So we invite everyone to attend our meetings. If you have any more questions regarding our meetings, you can always contact me, or if Ezequias doesn't mind, if you contact him, he'll forward that information over to me, and we'll be able to talk in more detail about that. We make sure that we cover all modes of transportation, and we make sure that we present what the group is actually interested in if you're interested in becoming a member. So our members are usually seniors 65 and older, people with disabilities, people that are caring for seniors or people with disabilities, and then employers or volunteers of organizations that serve seniors and people with disabilities as well. Making sure that we target the accessibility of our service, whether it be our applications or on our phone, our internet, our train stations, as well as our bus stops and our internet webpage. If you'd like to apply, you can always go to our website at valleymetro.org/accessibility/advisory group. And you could fill out an application online there. And then we would bring you in through an interview process where some of our members would be able to ask you very basic questions to see your interest in public transit. And then if you have any questions, you could always email vmag@valleymetro.org, which would be a little easier. Even if you want to still apply and have questions, you could always email that. That would go directly to me, and I'd be able to help you out there. That's pretty much it. It's a small update this time. I know there's a lot of up and coming projects that are happening, so I'm sure I will have a lot more at the next quarterly meeting that we have with TAP to give a much more thorough update. So thank you. Any questions?
Thank you, Guillermo. I was just wondering if you could touch base on your travel training opportunity.
Absolutely. So we have a travel training program that is for seniors and also people with disabilities. You do not have to be ADA certified in order to use our travel training program. What is travel training? Well, that is basically us helping you use our public transit system, whether it be scheduling a trip, planning transfers, or learning how to read our schedule. I know I've had situations where I was in a conference in Los Angeles and working in transit. It took me 30 minutes to figure out which ticket to buy, and I work in transit. So I know it can be a little bit overwhelming at times. So we offer travel training as an opportunity to help those that want to use public transit, can use public transit, but just need a little bit of help in order for them to be able to navigate and use the system more effectively. This could be on any mode of transportation that we have that is fixed route or light rail or streetcar. So if we are within that area, we have that available to you. We also do group trips for organizations. If you want to have a presentation about travel training and go on a group trip to see if there's interest in travel training, we have our travel trainers do group trips and group presentations as well on travel training. So I know there's a lot of nonprofits out here, as mentioned before. So if you need a presentation on travel training or a little curious about your clients, clientele, students, etc., we have the availability to go out there and give you a presentation on travel training and see if travel training is right for you. Coming up shortly, just a little blurb, we do have an event coming up called Train the Trainer, where it is a workshop that we teach you how to travel train. So you can actually teach yourself, your clients, students, etc. Once they've finished and completed your travel training, you could send them over to us. We'll confirm that they know how to do what you've taught them, and they will be eligible for a platinum pass for 1 year as a benefit for them using public transit. So that is something that we have as a kind of yay, you did it kind of thing, and make sure that we encourage their continued use of our service. So we have that Train the Trainer event. That event is coming up right now in November. It'll be at our downtown building, the 101 building. It is, one second, it's in November 4th, and it'll be from 7:30 until 1:30. If you have any questions regarding that, you could always email me. I'll put my email in the chat box and I'll be able to sign you up.
Thank you, Guillermo, for that information and all the resources. And again, public transportation is, excuse me, if your consumers are able to utilize it, it is an alternative transportation option. And all of these new, the app for the transit book, getting your fares, making it more accessible and having more options. I know I do have a sister who utilizes a wheelchair, and she loves light rail. It's just convenient. She can go on. It gives her more control of, getting on light rail like everybody else, and just traveling. So thank you so much for all of this information. I do highly recommend, if public transportation is a resource your consumers utilize, I would highly recommend looking into joining the VMAG group. It's a great group. They do talk about the schedule changes or anything that is related to Valley Metro Public Transit. It is a great opportunity for you to get involved and be a part of that discussion. Also, I would highly recommend, having information regarding travel training to your agency. I think that is such a great opportunity. And thank you, Guillermo, for providing that in Valley Metro. And travel training. As Akis and I had I attended a travel training. I would like to get an update because there's so many things. You're changing, you're providing different resources. So I think it'd be worthwhile if you did it in the past, maybe do it again to get up to date on the information that they have. So thank you, Guillermo. If anybody has any questions, thank you. Guillermo put his information into the chat. Also, if you have any questions, we're monitoring the chat. If you have any questions, we can also pass that along to Guillermo. So thank you. Anybody have any questions for him? I do have in the chat. Thank you.
Well, thank you very much. I do also want to say that with the new application, I know we don't have a lot of time using it. Our travel training group teaches you how to use the new application. And with the new fare changes coming on or anything like that, the new modernization system, as these new phases come in, our travel training group will be up to date with that as well. So they'll be able to teach on the new system.
That is great. I think I need a refresher course. So thank you for your time. Again, if you have any questions, you're thinking later, put in the chat and we will get those to Guillermo. I would just like to switch up the agenda a little bit. We do have a presenter that has some time constraints. So I am going to jump to agenda item number 6. The Disability Resource Connections. Thank you. And the purpose of our meeting is to provide you with information and resources to assist you in the work that you do. Today, we are pleased to have a presentation on a community engagement group called the Disability Resource Connection. And I'd like to introduce Michelle Thorne, who is a founder, executive director of Care for the Caregivers, and the administrative director for the Disability Resource Connection. Thank you, Michelle, for joining us. I'll pass this on to you.
Wonderful. Thank you for allowing me to speak today. And actually, you can take the screen down if you want to. I'm just going to talk today. Thank you. So my name is Michelle Thorne. I'm the founder and executive director of Care for the Caregivers. If any of you guys have parents who need some extra love and support, you can send them our way. That is our mission and that is what we do. Today, what we're going to talk about, though, is the Disability Resource Connection. The Disability Resource Connection is a group of organizations that came together to share resources, share information, and just to help everybody, right? We want to lift everybody's boats up together. So who participates in the Disability Resource Connection? We have the Northern Arizona Adaptive Sports. We have Southern Arizona Adaptive Sports. We have, I see Mr. Gus here. We have Ability 360 who comes to our meetings. Ryan House, Mikey's League, Miracle League, the Arizona Disability Water Sports. And again, what we do and what our mission is to try to make sure that everybody is informed about what everybody else is doing, sharing our information, our events across all of these different communities. So we have people in Northern Arizona who are trying to get people from Southern Arizona up to their events, and we try to strategize and figure out how we can do that so that everyone in the state has access to everyone else's events. The Disability Resource Connection has gone through a few different changes since its inception, but we basically meet once a month for an hour. We try to make it very quick, engaging, and dynamic. And during these meetings, we again share resources, share events with each other. We also have speakers come in that help us figure out how to, write better grants, how to do better time management, how to work collaboratively together. And so that is kind of the gist of what the DRC is. We are working on revamping our website, which is why I didn't show it today, but it's drcaz.org is the website, drcaz.org. And we've gone through, like I said, a couple of different variations of what this group is, and we're still trying to find our place with it. But all groups who work with the disability community are welcome to come and just share. And that's what we want. We want to make sure that everybody within the disability community has access to information, education, and resources, and that small groups have access and support to things that larger groups have. So for example, we have some groups that do smaller retreats groups, and we will have bigger groups say, hey, well, I can provide you with stand-up paddle boards, I can provide you with kayaks. And that way we're not reinventing the wheel, but we're sharing what we all have in common, trying to make sure that people with disabilities have access to sports around the Valley. And really, that's it. I'm quick and brief and hopefully to the point. Do you guys have any questions about the DRC?
Yes, if you have any questions, feel free to drop it into the chat or raise your hand and we get you. Gus says, thanks, Michelle. I definitely have attended a DRC meeting and it is a great resource. And I like how you say to not reinvent the wheel. We definitely want to all share in making the resources that we have stretch as as much as possible, because we all are under, we are probably at all capacity of the services that we provide. Michelle did put her email in the chat, and Ezekias, thank you once again for putting the email address for DRC. And I know recently, well, a couple of years ago, when I attended the DRC, they had a dialogue looking for resources to take consumers or participants in Special Olympics, and providing transportation services. So that's such a great resource.
Yeah. Just trying to make it easier for us smaller nonprofits to work together and get things done for the disability community all around Arizona, which is actually what makes it great, because we have organizations from Southern Arizona to Northern Arizona to Central Arizona. And transportation, we always love it when you guys come, because moving people around is one of our biggest barriers to getting them access to some of these recreational activities. So thank you for everything that you guys do.
Okay. Well, thank you, Michelle. And again, if you have any questions for Michelle, you can put it in the chat. We can get it to her or email it to us. So thank you for attending, and thank you for the information.
All right. Thanks, guys.
Okay. So I will get back to the agenda, and I will go back to our next agenda item. But before we get to our next speaker, I would like to go to our next polling question. And the polling question is, are you a Section 5310 subrecipient representative? Yes, no, but would like more information. Okay. And it does look like the majority of you are subrecipient information. So this next presentation it will be very informative for you. But we do have some participants here today that are not 310 subrecipients and would like more information. So that is great. Welcome. We definitely invite all of our stakeholders. So I'd like to go on to our next speaker. And I'd like to introduce Wendy Miller, who is a management assistant with the City of Phoenix in the Public Transit Department, who will provide some updates on the Section 5310 program. Thank you, Wendy.
Good afternoon, everybody. Thank you so much for attending. My presentation is very brief. As most of you are aware, that are the Section 5310 current subrecipients, we are in our reporting cycle right now for our annual reporting. So most of you are in the process of gathering your data for your vehicles and all the good stuff. So just a general reminder that those reports are due on October 15th. And if you're having any issues or you have any questions, please reach out to me or my staff, and we'll be happy to assist you with that and answer your questions. And just in general, that's what's going on. We are Secondarily, for last year's awardees, some of you have already executed your agreements. We are in the process of sending those out and getting those squared away. And uniquely, we are meeting with FTA tomorrow and ADOT to discuss our vehicle procurements and some of the issues that we've been having. So hopefully very soon we will have an update for you on who can proceed with the vehicle orders, doing the match letters, and getting you guys to send in your checks so that we can place the orders for your vehicles. So that's all happening right now and coming very soon. With that, that's the basic update of what's going on with the City of Phoenix program currently, and I'm happy to take any questions.
Thank you, Wendy. I just wanted to take a moment and thank Wendy and her staff at the City of Phoenix for those that are Section 5310 subrecipients with vehicles. I know they have been working tirelessly. Wendy, I know for a fact, has talked to FTA regarding the vehicle procurement. I would like everybody, thank you for your patience regarding the vehicle procurement for this year. But I definitely just wanted to take a moment and thank Wendy and her staff for tirelessly working on this issue. It unfortunately is beyond our control, but I'm glad we have staff has you to work on this issue. Does anybody have any questions for Wendy? I see something in the chat from Marcia.
10:15 is a Saturday. Yes, you can have it a couple of extra days and do it till Monday. I must have not looked at the calendar. It's typically due by the 15th, but yes, we will accept it by the 17th. Thank you, Marcia.
Thank you, Marcia, because I also have to hand in my progress report. So thank you for that. Does anybody else have any questions? Okay, thank you, Wendy, for your update. Definitely, if you have any questions regarding Section 5310, remember there's always this Section 5310 email that's dedicated for this. As a key, if you can put it in the chat, hopefully everybody is familiar with that email. So if you have any questions after this, definitely email it directly to the City of Phoenix, and it is section 5310@phoenix.gov. Thank you, Ezekias. Okay, if I don't see any other questions, I would like to move on to our next agenda item. And before our next agenda item, unfortunately, COVID is still a concern, and we'd like to get an idea of where your agencies are at regarding capacity. So our first polling question is your agency at full capacity? And we'll just give you a couple of seconds we almost got everybody. Okay. And I think we can close the poll. And it seems this is new. So we have about 50% of those of you participating today at full capacity right now with their agencies. About 40% are still not at full capacity. And it's interesting, and I'm glad to hear that about 11% never reduced capacity. So thank you for sharing that information. So the next part of the question is, if you have said you're not back at full capacity, what reasons are preventing you from being at full capacity? Is it COVID related? Is it consumers fear reopening? And I still hear that. Is it staff and hiring, or is it other concerns? And you can put that in the chat. And again, I appreciate everybody for participating in these polling questions. And we have about 50 of you. Okay. A majority of you, and this is what we've heard nationally. I believe we presented an update at the last TAP meeting where Ezekiel and I had attended the Community Transportation Association of America, the Mobility Management Forum there. And this is a concern we heard nationally regarding staffing and hiring is a major concern. So major concern, 73% of you are saying that you're not at full capacity due to staffing and hiring. Next is consumers fair reopening. As I mentioned, I still have comments coming in from consumers saying that they are still a little concerned, that because COVID is still around, that they have concern regarding going back to programs. COVID mandate next, and then other. And then I'm not quite sure what the other is. Voluntary recruitment is slowing and hiring is slowing and funding is down. That is a major concern. I agree. So to hear, so our next agenda item, we are happy to introduce Lori Thomas once again, who is a manager Healthy Aging, to provide information updates from Maricopa County Department of Health regarding COVID-19. So thank you, Lori, because I know we are still in that environment. We do see some slowing down, but it is important that we get the most up-to-date information regarding this. So thank you, Lori.
You're welcome. I guess it's time to talk about those exciting things like COVID, monkeypox, flu. Okay, here we go. Here are some trends for COVID. And just wanted to, these are for the United States. So you can see the trend that we had in early March. And there was a spike, and we are now seeing that trend go down as of September 11th. Next, let's look at that. That's the US. And in Maricopa County, we have had 1,416,505 confirmed and probable COVID cases. And then you can see this much larger scale and larger picture, but there you can see we've had a high spike, and then we are going back down to where we have been 2 or 3 times before. Next. And here's the curve in the last 60 days. So we are doing well. I know some of us think that COVID is over, and we would all like it to be, but we still are having cases and across the country. And as a total side note, my mom, who is 91 and very, very healthy, till day before yesterday. And so she is one of those that got it at the end.
Excuse me, Lori, you just froze a little bit. So you had just mentioned about your mother.
Oh, okay. I said
Okay.
my mom, who's 91, had both boosters, and she'd never had COVID until day before yesterday. And so COVID is still around. And so she has variant 5. And so you can still get COVID. And so we do have to still take precautions and be very careful for those who are at highest risk. Next. Now, there are different types of community level. In Maricopa County, for residents and individual or visitors, we are very low, which is good. In the 7-day case rate, our rate is low per 100,000 in the last 7 days. Next. Now you can see here the community level across the United States is different. Even to the right, if you look, there's Arizona, And to the far right, we have Navajo County, which is orange, which is still very high. And to the southwest, we have a little higher rate. But in the central part of Arizona, we are in the low rate. But that can change, as we know. Next. Now, this is community transmission for healthcare settings, and this is still high. And so this is high in Maricopa County, meaning that if you're in a hospital or a skilled nursing facility, the rate of transmission is still very high, meaning that new cases per 100,000 persons in the past 7 days, was higher than 100, over 100. So you can see that it's high all across the country. There are spots that it's moderate, but for healthcare settings. Next. So per CDC guidance, there is no level of community transmission where healthcare workers may choose not to wear a mask. So make sure if you're visiting in a skilled nursing facility or a long-term care facility, that the people that are caring for your loved ones are wearing masks. So universal eye protection is recommended, but masks are still required. Next. Now, these are Maricopa County deaths. These are a little bit more somber. Of these 17,884 deaths in Maricopa County, 3,051 have occurred in long-term care facilities. So careful with the infection transmission in those facilities. Next. Now, these are the type of variants. And if you look way to the left, there were different types of variants that were prominent. There was the BA2, the BA3, BA4, and if you go clear to the right, the BA.5 is the most prominent, that pink, and then BA4. So what we're having right now is the BA5. The good news is that the new vaccine has been specifically formulated for BA5. So if you get your booster, that is what it is targeted towards. Next. Okay, the new COVID boosters are here, and some of the recommendations have been replaced. Everyone 12 years old and older can get a booster 2 after 2 months or 60 days after their last vaccine. I think the important takeaway here is that you can mix and match, meaning that if you had Pfizer, if you had Moderna, you can get these new boosters, but you can't get this new booster as your primary series vaccine, meaning you can't go boost, never had the primary dosage. So when you go, if you've not had any, you need to make sure that they know that so they know what kind of vaccine to give you. And it is A-OK to get both your flu shot and the COVID booster at the same time. So there isn't anything contraindicative about having them at the same time. Now, I don't have this number on this slide, but if you need an appointment, you can call 602-506-6767, and they will make you an appointment for either the booster or for the first vaccines that were available. And that is a call center that we have at Maricopa County, 602-506-6767. Okay, next. Okay, let's talk about monkeypox. I want to say that in Maricopa County, I'm on the periphery of this. We have done a really good job of getting to those most at risk and in communicating about the disease and how to take care of it. It is a viral illness that primarily spreads through skin-to-skin contact, and it can also be spread through respiratory secretions during prolonged face-to-face contact. Confirmed and probable cases in Arizona. You can see that we are not one of those states that have had really high rates, but there have been almost 22,000 confirmed cases in the United States. Next. Now, in Maricopa County, we've had, as I said, the 304 cases. Take a look at that. Our highest cases were in July, but then take a look at that yellow line, and that is the number of vaccinations that we've had. And I've been at events where we've had 1,500 to 2,000 people getting vaccinated. And those are people that handle testing, that all types of people that are at high risk. And I want to give a shout out to the, and I'm not sure I'm saying this name right, the Southwest Center for HIV. They have done a tremendous job in educating and holding events and planning events for immunizations. These types that the county health department could not have done without these kind of partnerships to show that level of immunizations and that outreach. So we feel like we have done a really great job so far in controlling the outbreak. Next. Recommends vaccination for people who have been exposed to monkeypox, people who are at higher risk, who have been identified by public health officials as a contact with someone with monkeypox, whose jobs expose them to orthopox viruses, laboratory workers, some designated healthcare and public workers, and people who are aware that one of their sexual partners in the past 2 weeks has been exposed, diagnosed with monkeypox, and people who have multiple sexual partners in the past 2 weeks in an area with known monkeypox. So that is the information that needs to continue to be disseminated to all of our state. Next. Okay, I just noticed that there is a V left off of maricopa.gov, but you can go to www.maricopa.gov/5825 monkeypox and find out where these vaccinations are happening and all the information that you need. And there also is a survey, monkeypox vaccine interest survey that you can take if you are interested. Next. Okay, guess what? It's flu season. We are trying very hard to get individuals that are at high risk to get their flu shots or their flu vaccinations early in the season. And there's some guidance here. COVID-19 vaccines can be administered with influenza vaccines. We just talked a little bit about that. And we would like to see so many people vaccinated before the onset of influenza in the community. And timing of the onset, peak, and decline of influenza activity varies every year. We still have people getting the flu in April, but this is when the vaccines have arrived. I'm sure you've seen it at all of the CVS and the Walgreens and Safeway. So they are widely available. If you do not have insurance, you can call that number 602-506. Yeah, what is it? 6767. You can get an appointment, and there are flu shots available through Maricopa County for the uninsured. So what we don't know is how well the flu shot, the flu vaccination that was put together a year prior is going to be, and how effective it's going to be for the flu strains that actually come, because they are put together almost a year before. Next. We kind of looked at the Southern Hemisphere to judge, how we're doing, because they get flu before us. Australia's had the worst flu season they've had in 5 years. It started earlier than usual, and they didn't have enough natural or vaccine-acquired immunity. But it's not great when someone gets COVID and flu at the same time. People can be very ill. And again, we're not quite sure how effective this current flu is against the circulating strains. And I guess we never are. Next. These things have changed for kids. The quarantine is the new, you don't have to stay home if you have been exposed. If you're exposed, you wear a mask for 10 days and test yourself after 5 days. And vaccination status is no longer a decision point, I guess, for, and I'm not actually sure what that means. I have to say that now that I read that. So let me get that clarified as far as schools. Some schools are requiring that and some are not. For individuals under 2 years old and those who may have difficulty wearing a well-fitting mask consistently and currently layering additional prevention strategies is recommended. Individuals who cannot or should not mask may attend childcare or school after exposure, as long as they are not asymptomatic. So guidelines have changed. If you have COVID, you still need to quarantine, you still need to stay home. But if you've been exposed, you can just wear your mask day 5. So these things do change, as you know. So next slide, if there is one. Okay, these were taken from Dr. Nick Staub that he presented to healthcare partners. I just wanted to make sure and give him credit, and Dr. Stemler for that. So I can try to answer questions if you have any.
Thank
Going
you, Lori.
once, going once, going twice.
Thank you, Lori. You did cut out a couple of times, but I think we got the gist of the information that you presented. Does anybody have any questions? Let us know, or you can also put it in the chat. I would also like to thank Ezequias once again for putting the phone number in our chat. The 602-506-6767 if you would like to make an appointment for a COVID shot and the flu shot. So thank you, Ezequias, for that. Also, thank you for the reminder that if you have not had your primary COVID shot, you can't get the booster yet. That's correct.
That is correct. You can't get the new booster. You need to have one of the original, the Pfizer, the Moderna vaccines.
Thank you. Thank you. And thank you for sharing the information regarding your mother getting COVID. And I just recently had a family member and a close friend who went through this whole season, not having COVID and just recently having COVID. So it's still here with us. They're both, they got the primary and they got boosted. And I don't, it wasn't as bad as, those that I've heard, but they still got COVID. So we're still in that environment. So we greatly appreciate all this information that you're providing to us. And especially since a lot of us here today are service providers and the consumers, and they could some could be immune health.
Immunocompromised.
Yes. Thank you for that wording. Yes, definitely. So this is definitely information that we want to if take back to the organizations and share with that. And as always, we do post all of the presentations on our MAC website. We will try to get that link revised. And we will post that on our MAG webpage.
Well, great. Well, thank you for letting the Maricopa County Department of Public Health visit. And if you have any questions, please feel free to call me or that line, and we'll do our best to help you with what you need.
Thank you so much. And again, if you think of any questions you would like to ask after this meeting, definitely email us and we can get that information to Lori or email her directly. And again, we are getting thank yous in our chat box for your presentation. Thank you so much for being a great partner and sharing this information.
Thank you.
Thank you. Okay, if there are no questions, I will go ahead and move on to our next agenda item. And this agenda item is where we give our stakeholders, you today in the audience, the opportunity to spotlight the great work your organization is doing for our community. And today we have Gus Lenzier, who is the Vice President of Operations of the Sport and Fitness Center, to provide an overview of the programs at Ability 360. Gus, I would like to hand this over to you now.
Hello, everybody. Thanks for allowing me to do this, and we'll go to the next slide. So I'm in charge of the Sports and Fitness Center as well as operations, but we're going to talk about Ability 360 in general. I see a lot of familiar names, so I will answer any questions for those that have some questions at the end. But this is our campus. We're in between 48th and 50th Street on Washington. This campus is about 15 years old, and our purpose is to empower people with disabilities to take personal responsibility to live as independently as possible in the community. Some of the organizations that are here are actually partners with us on campus. For example, the Spinal Cord Association, UCP has an office here. We have Arizona Autism United, Raising Special Kids, the MS Society, the Brain Injury Alliance of Arizona, and more, all on this campus with a couple of conference rooms and classrooms. So if anybody ever needs a conference room or classroom setting, please let us know. We're happy to accommodate, and we try to be a lot more affordable than hotel rooms and et cetera. So please, if you need to have a conference space, let us know. Next. This is the picture of our Sports and Fitness Center. We're one of 4 facilities throughout the country that were built with purpose and intention to serve people with disabilities. Our Sports and Fitness Center is 11 years old at the end of October, so we're pretty proud of that. Currently, we have about 2,100 members, and we're inclusive. So when we talk about our main programs and our core services as a center for independent living, advocacy, community integration, independent living, youth in transition, those are all federally funded programs specifically for people with disabilities. The Sports and Fitness Center and our home care service program are not federally funded. And due to that, they can be more inclusive to everybody. So for example, the Sports and Fitness Center was built with purpose and intention to serve people with disabilities and their families. However, anyone can work out here. Anyone can use our pools, the basketball courts, etc. They just have to remember that our mission is mission-based, and we have priority for our adapted sports teams to use the courts, etc. But currently, out of those 2,100 members, 650-ish are veterans, because we only charge veterans and active duty military $25 a year to have a membership. And those with disabilities, if they can't afford $35 a month to have a membership, we have scholarships as little as $9 a month. And if they can't afford $9 a month, then they can volunteer for a day and then work out in that same day. So we really try to take the barriers of any kind of financial aspect away from health and wellness. Next. Got to go to unmute. All right, here we go. So we talked a little bit about our memberships. We have about 2,100 members, as I spoke about. We have several different types. One thing that we're pretty proud of is for people that are in transition. So people that are new to their disability. For example, someone with a new spinal cord injury or a new brain injury, or maybe they had a stroke. It doesn't matter what rehab they went through. We provide a 1-year sponsored membership at the Ability 360 Sports and Fitness Center. What's included in that is dial-a-ride vouchers if they need accessible transportation. We partner with the Spinal Cord Association to provide door-to-door transportation for people that are really new to their disability. And that's a great 5310 partnership right there. We have membership classes. For example, we have 35 different classes a week, ranging from yoga to Zumba to stretching. So we really try to work with everybody, whether they're walking or rolling in our classes. We provide recreational therapy, personal training. We have a lot of youth programs. So if you work with youth with disabilities, please let us know. We have been very fortunate to receive some funding that we're happy to partner up with other organizations on. You saw our pools. I actually went swimming today at 11, and that person who was swimming last in the video was actually swimming right next to me. A lot of these people were so excited to make this video with us. It's kind of fun to watch some of the areas we've renovated as well. I talked about our military programs. It's only $25 a year to be a member here for veterans and active duty military. We have a slew of different senior programs, and we do more than adaptive climbing. So in the last year, actually January 1st, if you're familiar with the nonprofit called Daring Adventures, which used to be the adaptive recreation arm of the city of Phoenix for many years, we absorbed them in January. And what that meant is we actually got their 5310 vehicle, and we have been doing more and more outdoor programming, whether it's adaptive climbing, kayaking, paddleboarding. And we actually, at the end of August, which one of their big trips they called Mainstream Expedition, we actually did a 12-day trip with 25 people with disabilities, volunteers, and staff down the entire Grand Canyon. So that's 226 miles. If you want to know what it's like sleeping under the stars for 11 nights, it's a lot of fun, but during the middle of summer, it got a little toasty, but it's well worth it. So next slide. We offer a lot of field trips. So if you're working with school groups, or I was actually talking to Excel today about partnering with them on some programming, we do that. We talked about renting out the conference center, but if you want to do team building here, we can do the climbing wall in a group of other programs. We use volunteers. We have a lot of internships. Currently we have a recreational therapy intern, nonprofit leadership intern, exercise physiology. We do sport-specific training. 360 Outdoors is all the outdoor programming that we're doing. We partner with the city of Phoenix quite a bit in our adaptive golf program. And then you can see the different sports that we offer: wheelchair tennis, curling. There's actually, if you don't know, there's actually a curling center just south of where we are in Tempe, and it's a lot of fun. So if you're looking for a great team building program, it's a lot of fun there. We have wheelchair basketball, rugby, lacrosse, football, softball, amputee basketball, power soccer, and the list really goes on. But we use our vans, specifically our 5310 vans, a lot to transport our athletes to tournaments, but also when we have tournaments in town. For example, we had goal ball in January, which is for people with visual impairments. We were picking up athletes to and from their hotel, the airport, and here, and we had 60 athletes in January. And when you saw, it kind of reminded me when we were going through the COVID discussion about the height of that and all the things we had to work through with those athletes to make sure that that tournament was as safe as possible. Next slide. We have programs specifically for teens. If you work with youth, you know that sometimes 15-year-olds don't want to play with 8-year-olds. It's just the way it works in the world. I actually have a 14-year-old, a 16-year-old, and an 8-year-old. They all get along, but they're at different development stages. So we have specific teen programs. And actually the JAM organization, you see the logo on the bottom left, provides sports equipment for individuals that play adapted sports under the age of 18. And we have a grant process for that. So if someone needs a wheelchair basketball chair or registration to an event, we actually grant people funding to do that as well with JAM. And the Thunderbirds are a great partner of ours. I'm sure as many other people on this call. Next slide. Here's some of our programs that we do in our 360 Outdoors, kayaking and paddleboarding. You see the adaptive climber there on the left. That's at Tom's Thumb up in Scottsdale. We've actually taken youth to Joshua Tree as well. And we've done trips up in Prescott and Flag, working with Northern Arizona Adapted Sports, as well as Arizona Adapted Water Sports, like Michelle was talking about. We're a proud member of the Disability Resource Connection. And we do swimming. So we have our athletes, they practice here, but they do meets all through the valley. East Valley Swim League is the one we are currently in, but it's great for us. Our coach is, his name's Joe. He has competed internationally as a para-athlete, and he's a great coach for us. So we're very excited to have him roll into swim meets and coach our team. Next slide. We do something called for our youth sports clinics and camps. We have this last Friday, actually, we had family hockey night with the Coyotes. So they brought in a lot of their inflatables and their development staff to coach kids with and without disabilities how to play hockey. Our Max in Motion is an adapted sports clinic for people new to adapted sports to get introduced to it. And you can see the summer camp picture of the individuals swimming in our therapy pool. Next slide. We do a lot of outreach to different schools. So if you are school-based and you want us to do a disability education, or you'd like us to bring our therapy animals, whatever you might need. Actually, Caitlin is one of our program coordinators, and she was actually at a school today talking about disability awareness and adapted sports. So we're happy to go do that as well. Next slide. Here's Katie and her therapy, Darla, a great bulldog. Next slide. So we do a lot of adaptive fitness here. So you'll see equipment in our fitness room that is very typical. And then you'll see some additional things that make things possible, like active hands. That's actually a glove that can go over someone's hand to assist with grip over a dumbbell, barbell, machine, upper extremity erg, whatever it might be. So all of our equipment has Braille on it. We have equipment with ramps. And we also teach everybody how to use the equipment. So for example, say someone lives in the Far East Valley and they don't want to drive all the way here or the Far West Valley to work out. We'll actually train them on how to use typical equipment in their local gym, so that way they can exercise more than driving here. Because sometimes 45 minutes in a car when it's 115 degrees outside is not so great. So we want to make sure that we teach everybody what they can use. We've actually worked with a lot of other gyms too about being as inclusive as possible. Next slide. Of course, we have to list, wanted to list some of our partners. Of course, I started with MAG. The City of Phoenix, all our partners at Ability 3 Center. We're partners with all the hospitals and rehab facilities. We don't do physical therapy or occupational therapy here at Ability 360, but we partner with Barrow. And this last weekend, we did an amputee swim clinic with Encompass Health. So we want to be a community partner versus a community competitor. We work with a lot of different disability organizations, ASU and other universities, other teams locally, the Diamondbacks, the Suns, the Rising, the Coyotes. The Cardinals are a sponsor of our wheelchair football team. And then, of course, any school in the area. And we actually go to schools and teach independent living skills through our independent living programs and advocacy departments as well. Next slide. Some quick pictures of our amenities, locker rooms. We have changing mats for people that might need to change out of their power chair. Next slide. All of our showers are accessible with shower chairs, and you can't really see in the picture, but we have the gauge on there, or the handle, actually shows you what temperature the water is. So if you can't feel the surface of your skin, you can set it to a surface certain temperature and know you're not getting burned. Next slide. Here's a good look of our pools without the lane lines in them. It's probably during the winter. We do close them during the winter. They're pretty expensive to heat, even in Phoenix. Next slide. It's a picture of our rock wall. We do indoor and outdoor climbing. Next picture. And that's kind of it. So any questions? We do a lot of Ability 360. It's hard to talk about all the different programs we do in a quick presentation, but the gist is we're a Center for Independent Living. We want people to be as independent as possible. We're a great resource for the community, and if we don't do it, we definitely share who the community does. We actually have one person that's her specific job, and we do share information about everybody we know about, the Spinal Cord Association, care for the caregivers, everybody, UCP, and it's great when people use our campus too, because then we know you personally and we can give a name out as well. I'm happy to take any questions. I know we've been in this meeting for a little bit, but I'm here for you, and my email's here as well. Monthly membership is $35 a month. And then families up to 5 people in the same household is $60 a month. So we haven't raised our prices since we've been open, and we don't anticipate doing that anytime soon.
Thank you. That was going to be my question about the monthly membership. If somebody was interested, and I've been to your facility, and I'm not see it is larger than there are more spaces and larger than I thought. So if somebody is interested in touring your facility, are we able to get a hold of you or
Yeah.
Ability 360?
Just email me and I'll direct traffic.
Thank you.
And how does one apply for training? And just I would email me, and then I'll forward you Brielle's information, because what we would do is a fitness room orientation here, find out where you go, know what kind of equipment they have, and then show you. I have a saying, do as little as possible to make something possible. And then we'll show you how to use active hands or use other equipment. Planet Fitness has made an agreement with the US, it's called the US Access Board, to make their facilities as universally designed as possible and have all the inclusive pieces that we have, which are textile and adjustable, seat-wise, so you can roll right up and use as well. Planet Fitness is doing a great job as well.
Thank you. And I just wanted to mention your video was great. Thank you for providing that to us. And that I was just watching that, and I was amazed at how large and how many stations you have in your facility. So thank you for that.
You're welcome. Well, I'll be honest, we stacked that video, but a lot of our members were like, when we did signups, they signed up over and over again. So it's kind of fun, like when you watch it over and over again, to see the same people in different sections. But it took us 3 days to do, and our members were just all over it. So it was a lot of fun.
That's great. And they pass that on. They did a beautiful job. And then you have a compliment. Thank you. And beautiful facility. And it's great. If you haven't been there, I would recommend, going down and taking a look at Ability 360, not only on the outside, but whoever did your interior decorating or architecture did a great job. And the bathrooms, I appreciate, as a person of smaller stature, I appreciate the accessibility of your facility and the restrooms. Does anybody else have any other questions? Well, again, if you think of any questions after this, after our meeting, feel free to email us and we can get it to Gus, or email Gus directly. His contact information is on the screen. And again, we will have all of our presentations available online. Thank you, Gus. We truly appreciate that, your presentation and the great resources you provide to the community.
Thank you.
Okay. I would like to go on to our next agenda item, which is Human Services Transportation Updates. Previously, the issue of catalytic converters was an issue facing a lot of our providers with vehicles. In November of last year, we pulled together a focus group with some of you here today to talk about the issue, talk about best practices, sharing information. And so we pulled all of that information together, catalytic converters, best practices, and made that document available on our MAG website. Since that time, I believe at the beginning of the year, there was legislation regarding the selling of catalytic converters to help with this issue and hopefully slow down the theft by, hitting those that are buying the catalytic converters and selling it to recycling centers. So just recently, I heard the topic of catalytic converter theft recently in the news. So I wanted to come back to you. I know it's been a year since we had a focus group, but I wanted to come back to you and ask you a couple of polling questions regarding this issue. So Ezekiel, if you can pull up the first polling question. And I like to see, is the theft of catalytic converters still an issue at your agency? And if you can let us know, yes, no, or you're not sure. I just wanted to gauge if this is something that we need to take a look at. And again, I appreciate everybody's participation in these polling questions. I would say about half of you are saying it's not an issue at your agency. 33% said yes, it is, and about 13 or less than half are saying you're not quite sure. So thank you for that information. So on to our next question. If it is still an issue, would you, or anybody, would you be interested in attending another focus group on the issue of catalytic converter theft? And unfortunately, it's still an issue, and it was still in the news. But I wanted to see if we should revisit this and see if there's anything more that we can share. Okay. So, almost 50-50. So I do see some interest in attending another focus group regarding catalytic converters. So I would just like to, I'm going to take that as, yes, there is some concern, and just revisit this topic once again. It's always good. I know we always ask you to attend a focus group and get, your comments and feedbacks. And a lot of times we don't circle back with the results of what became of that. So I'd like to circle back, and I will be we will be setting up a focus group to revisit the catalytic converter discussion and get your feedbacks and comment. As Zacchaeus will be sending that out, and we can see if there's any other resources that we can bring to you. So again, I greatly appreciate everybody, and it's great that half of you, this is not a concern. So that means there is some progress made on that. So thank you for that. We appreciate you answering these questions, and a lot of times we'll ask your feedback and comments on some topics, and this is where we get our ideas on workshops and trainings that you are interested in. So thank you so much for your participation. I'd also like to say, I'd like to remind everybody that we will be moving forward with our 2023 Section 5310 application process. We are currently working with the City of Phoenix on updating the application materials and the handbook, and hopefully kind of confirming our vehicle procurement information. So again, I'd like to say thank you to Wendy and her staff, Stephanie. I'm going to forget somebody. all of our staff at the City of Phoenix for their support and help and working with us as partners so that we can get this application out to you next year. For those who have applied in the past, I just like I would like to thank Ezekias because he did develop an application dashboard for those of you who applied in the past so that you can see where you ranked and most importantly, what categories in the application process you scored well in, and some you may need a little bit feedback on to improve. So we do have that information if you would like to reach out to me or Ezekias, and we can meet with you one-on-one to provide you with some with information on how you did on applications in the past. Oh, I know. Yes, thank you, Ezekias. He is our data guru. You know, he can pull data from all over, and I'm so thankful that he made this dashboard because an example is that in the previous application process, an agency did meet with us. We reviewed we reviewed their data, we reviewed the application process and where they kind of scored. And in this year's application process, they actually improved in their ranking. So thank you, Ezekias, for providing that resource for our stakeholder, our subrecipients. So if you would like to reach out to Ezekias or I to set up a meeting to discuss, you know, your past application, or if you're new and is interested in applying for Section 5310 funding, please reach out to us. We are here to provide you support, and as always, the City of Phoenix staff is always there to offer you support. So these are just some of the topics and issues that we are looking at on a regional level. Again, we value your comments and your input to help us in looking at what are some of the topics or what do we need to start, what are some of the resources that we need to start looking into to help you as our service providers. Again, you are the ones on the front lines providing services to the community. And our sub-regional mobility managers are such a great resource. They are from nonprofit agencies such as yourself, and they provide us great input on a lot of the issues and topics and workshops and trainings, and that helps us to when we're strategizing on what we need to present to you. So I would like to thank our mobility managers, and coincidentally, that is our next agenda item. So I would like to hand this over to Ezekias Oja to introduce our next agenda item. Thank you, Ezekias.
Thank you, Didi. On this presentation from the Sub-Regional Mobility Managers, what we want to do is that we know that most of you, if not all of you, have participated in some of our workshops and trainings in the past year and before that as well. And you have learned and shared your expertise and learned from the expertise of our sub-regional mobility managers and their staff and their staff on what they do and in topics related to this to the workshops and trainings that we have. However, we know that just like you have so many other projects and programs in your agency that are great programs and you have best practices, our sub-regional mobility managers also have those, and sometimes they don't get the chance to share those in the workshops and trainings. So we opened this session for them so they can provide you some of the best practices and new programs that they have implemented and have been successful in their agencies, and maybe this can spur a new idea for your programs, or it can improve the services and projects that you have already implemented um, on your agencies, or even spur some connections that you can have partnerships with with the sub-regional mobility managers on the programs that they have. So we're going to open the floor for our sub-regional mobility managers now to provide a little bit of the background on their presentation, on their programs, and the best practices they have implemented in their agencies in the last couple of months and in the last couple of in the last year. And first of all, I have in here is Mark. Mark, unfortunately, are not able to attend today, but he did send a representative from Gumpers to provide this update for them. So I welcome Travis.
Hello, good afternoon. My name is Travis Harris. I'm the special ed director at Gompers Private School, and I'm filling in for my boss, Mark Butterbush. So the first thing he wanted us to highlight is how we trained members to sanitize. They're like sanitized machines, they're like foggers. And we trained the members to sanitize our building and vehicles. And then they also work with our business solution partners. So they're out in the community doing the same thing. It's non-toxic, biodegradable. You just spray it on every surface. The only real downside is if you leave papers out, they kind of curl, but it kills COVID-19. It kills a lot of the other, flu viruses and things like that. Over the summer, we started a split time program for members that are in DTA but want an opportunity to work a little bit. So it is a center-based employment option. This started because we had a student that was graduating our school, transitioning, wanted to work, had the ability to work, but just needed a few other supports throughout the day for his activities of daily living. So it's on site at our DTA program in Phoenix. Word quickly got around with other members and everyone wanted a job. So it filled up very quickly. Another thing we instituted was we worked with a company called Kinetic Ability. And what they do is they provide like recreational activities, kind of like adaptive PE for individuals with disabilities. It's like a 1-hour program and we love it because they come to us with everything. They have their equipment, they have a lesson plan. It's nothing that our staff need to do. And so members were able to, do about an hour's worth of activities. It was really great. And even the ones that didn't want to participate, some of them came down just to watch. So it almost became like a spectator event too. And then the last thing is dash cams in our vehicles. I'll be honest, I don't know what that is. I just assume it means we're getting like the forward mounted dash cams for accident prevention and stuff.
Yeah, for that one, Travis, what Mark has told me, and these were some of the cameras that they got with the 5310 grant
Okay.
application. And these cameras, they are both forward facing and inside facing. So they're dual cameras, and it's helping Gumpers on monitoring and also being able to coach drivers on how to handle their driving skills as well as dealing with the passengers in the vehicle. So it's improving the quality of services for Gumpers in that situation.
Oh, well, thank you. And I'm a reserve driver for the school whenever someone calls out, so that impacts me too. Mark did say that I might get questions if someone wanted to know something specific regarding education and transportation. I'll be happy to answer any.
Yes, so if you have any questions for Travis and Gumpers or any of the other sub-regional mobility managers, you can save it for the end, or you can put it in the chat, and as we get it, we'll give it to our mobility managers. But thank you so much, Travis, for filling in for Mark on today's presentation.
Thank you very much for having me.
Next, we have Justin Mcgregor with STARS.
Yes, thank you, Hezekiah. So I'm Justin Mcgregor. I'm with STARS. I've been a sub-regional mobility manager now for going on 4 years. So just some of the items. One of the things that our organization does that's pretty new is we do interactive music therapy. It allows the participants to, I guess, move and interact with the music and be a part of the program. Let's see, we also do, just like Gompers, the sanitization. We do our buildings and our vehicles. With our vehicles are done pre-trip and post-trip. And then another thing that I recommend that I do myself is for new hires. I do pre-screening interviews prior to doing in-person interviews. That way you can gauge to see how interested they actually are in the job. And that's it.
Thank you, Justin. And for these pre-screening interviews, how are you doing them? Are you doing them through Zoom, through phone calls?
Both over the phone or through Zoom. Not everybody has a good internet connection, so I give them the option of phone or Zoom.
All right. And have you seen an improvement on the numbers of the people that you actually do the in-person interview actually getting hired?
About a 50% increase of better candidates coming through the pre-screening.
Right. Perfect. Thank you, Justin.
Mhm.
And again, if you have any questions for Justin, you can put it in the chat, or we will open for questions at the end of the presentation. Next here we have Billy Parker with Chandler Gilbert.
Thanks, Ezekias, and thanks everybody for coming to this TAP meeting. And it's been really interesting, and actually a couple of the best practices that I have illustrated here really had to do with oh, I can't start my video. Okay, here we go. Okay, they really had to do with personnel and staffing. So it was really interesting to hear the statistics on programs that are not completely open, because ours is one of those programs. So we've really put a lot of energy into finding employees, and we were a recipient of ARPA, American Rescue Plan funds. And so we really targeted a lot of our funding toward sort of incentivizing employees, and really came up with some interesting statistics. For about 3 months, we were offering a $7,500 sign-on bonus to attract employees. And really, as probably some of you would expect, we kind of expected people to be breaking the doors down and coming into the agency, which really didn't happen. In 3 months' time, we hired 12 people, which was really shocking. So, we kind of really looked at that, and we ended up changing that $7,500 sign-on bonus to a $1,500 sign-on bonus, but we increased our hourly pay, and we ended up hiring 12 people in a month by doing that. So we thought that was really interesting for a couple of reasons, because if a person were really to look at do the math on that, they would find probably that over a period of 6 months or so, when the sign-on bonus was being paid, a person would really make a lot more money if they were to take the $7,500 sign-on bonus and the salary that was $2 or $2.50 less than what we're offering now. So we thought that was, just an interesting way to kind of look at it. So we felt like that research was really a good move for us. So a couple other things, we're looking at really targeting demographics, and we put some data together and determined that of the direct support professionals we have, about 49% of them are 51 years old or older. So it made us think either people of a younger demographic either are not very interested in working in this kind of work, or we're not really targeting people the way that we possibly could be. So we changed a couple of things. We have a TikTok account now, which is something that's brand new to me. I don't understand it, and a lot of us older people don't understand it, but it has generated some interest, and we have a bunch of TikTok videos that are mostly kind of silly. And we also hired a sign spinner that stands out on the street and spins a sign. And we've had probably 6 or 8 people in the last 2 months that have actually come in and said, I came in because you have a sign spinner, which I would have thought, I was really surprised to see that. So that's another item that we kind of really looked at to kind of really target a different demographic. So things are starting to pick up for us, and we're happy about that. So we're also, in our American Rescue Plan, we also hired a consultant that there's a contingency of American Rescue Plan dollars that says that you have to use them for your direct support professionals, and you can use them for training as long as it's not the training that they would normally get as a new employee. So we hired a person by the name of Dr. Tom Pomerantz, who's a really well-known consultant that travels all over the country, and he's been around for a very long time, and he's got a really excellent reputation. So we earmarked some American Rescue Plan money to actually have him come in and work in each of our houses with our direct support professionals and their supervisors to really help them, I think, with some just contemporary practices and different things like that. So a couple other things we're doing. We started a relationship with Discount Tire, which has been really nice, where it's actually an on-site service that they provide. So they will come to a site for a $50 trip charge, and they'll go through all of your vehicles for $2.50 per vehicle, look at all the tires, make sure they're okay, and then rotate them if need be, which is all part of the $2.50. So we really felt like that was a good, really very true preventative maintenance process to have them be able to do that, and they could do it. We have a couple of administrative buildings, so we have a fair amount of vehicles all in the same spot at the same time, and our 2 buildings are so close together that they only charge us 1 trip charge for both buildings, and there's probably about 15 vehicles at those 2 buildings that they look at. So we felt like that was a really good practice, and so far it seems to be working out really well. If they identify vehicles that need new tires, or a tire needs to be repaired or something, then they will do the repair on site if they can, or they'll fix the tire or replace the tire and come back and replace it. They charge for the tire replacement, as you can imagine, but they don't charge for another trip charge. So it seems like it's been a really pretty good program that we've done with them. So I think that's really about it for me. We're working with Maricopa Community College also to try to generate some interest from students that are going to the community college that are interested in picking up hours working for us in exchange for us assisting them in paying their tuition. So that is in process right now. We're doing some outreach activities and getting involved in some of the outreach events that the school is putting on. And the nice thing about it is to be connected with the community colleges. All the materials that we generate in that realm apply to all the community colleges in the Valley. So everywhere, which is a lot of students. So we're kind of hopeful that that will help to also generate some interest and get us some staffing support that we need. So that's about it for me, unless anybody has any questions.
Thank you, Billy. And if you have any questions, again, you can put it on the chat and we will open up for questions at the end. And last but not least, Eric Panic with the Centers for Rehabilitation.
Hi, good afternoon, everybody. My name is Eric. I'm the newest mobility manager for the South Central region. I'm just about finished up with my first year. Let's see. So some things that we've been working on to go along with what Billy mentioned about the discount tire. We created a solution in-house where rather than uh, rather than doing that, we just started placing an air compressor outside every morning, not only for our company's fleet, but also for our employees' vehicles as well. They're welcome to use that. We've noticed, definitely noticed an improvement, and it's also beneficial to our employees to have another resource to help make it to back and forth to work safely. Actually, after hearing about this discount tire partnership, this is something I'm going to be looking into as well. Another thing is for preventative maintenance, we just started creating our lift maintenance, doing it every time we do an oil change, just to make sure that we're getting more eyes on our vehicles. We've noticed a lot less downtime with our lifts, and just we're making sure that they're getting fixed on our schedule rather than when they decide to break. Let's see, one thing that I'm really happy about is we just finally got approved for an MVD Now online account for all of our tags and registration. We currently have 23 vehicles in the 5310 program, and our total fleet is about 60. So it's a lot of tags and registration to worry about. So this is a great resource for us to have it all in one place rather than waiting for the little flyers in the mail and that sort of thing. Let's see. One thing that wasn't on the list that I'd like to quickly mention, with all the COVID and flu discussion, this last week we had Walgreens out at our site to do a vaccine clinic for both the COVID-19 and the flu vaccines, for both our supported individuals and for our staff. We've been doing that now for a couple of years, and it seems like to be a great program. If I can, I'd like to turn it over to our Director of Development, Don Hawking, to mention some of our community involvements.
Excellent. Thanks, Eric. So just a couple things that we wanted to mention was we have a music therapy program we started a year ago through a grant from the Tempe Community Council, and we partner with a Higher Octave Healing, and they created a drum circle and a bell choir, and we did a performance last spring, and this year they've increased our funding, as well as we've received funding from the Tempe Diablos to now create a choir as well and do some one-on-one sessions with some of our supported individuals to see how we can incorporate music into their everyday, or to get them to a point where they could join one of the groups if they're not already in one of the groups. And it's just a really fun program, and the fact that we've been able to grow it is amazing, and we wouldn't be able to do it without our partners. The other partnership that we created this last year, which is really fun, is we received funding from the Thunderbirds and the Diamondbacks for our PASS program. And the focus of the activities are art, science, and cooking. And I was trying to find somebody to come in and do cooking classes with us. And it was really hard to find people to come to our group homes. And I've created a partnership with Rio Salado Community College and Cafe at Rio. So we have one of their chefs comes in, they bring all the supplies, and they teach at each of our group homes when we schedule them. And it's been a really unique opportunity that also came because of grant partnerships, but now we've got a new partnership that we can expand on as well. So those were just two of the newer things that we've been doing.
Thank you, Don. Sorry, just something's in the background here. Thank you, Don, for your and Eric as well for your input on this conversation and for the great work that TCH has been doing in our region. I do have a question here, and that was for Justin, related to your hiring. And Marsha was asking if you do retain the staff after training, have you seen an improvement also in the amount of staff that you are keeping after the training with your phone screening interviews?
Yes, thank you, Hezkia. Pretty much everyone that I've hired since I've done the pre-phone screening prior to the in-person one-on-one interviews has stayed on board so far. So so far it's working just by gauging their general interest in the job position prior to doing an in-person interview. It's saving a lot of time, you know, instead of having them come in and then or not even have them show up for the interview is another big problem. But when you gauge their interest through either the Zoom call or the phone call, then you know if they're serious about coming in for an actual in-person interview.
All right, perfect. Thank you, Justin. And if anybody has any questions, please feel free to put it in the chat, or if you want to unmute yourself, you can also do so. I just want to thank all of the mobility managers for this presentation and for all the help and the support that you provide to our subrecipients and stakeholders in the region. Um, uh, the work that you do is very valuable, as well as the work of everybody that is attending here today. And I don't see any more questions, so I will get back to you, Didi.
Thank you, Ezekias. And again, I would like to echo the thank you to our sub-regional mobility managers. I know a lot of our participants here today see you quite often in your trainings and workshops, but providing this additional information on what you what you're doing at your agencies, not just only pertaining to transportation, but all around the programs that you provide at your agency is very helpful. And I know almost all of you touch base regarding employment and training. That is an issue that we definitely want to continue to look into. And we want to bring some more resources. Thank you for sharing about the sign, person, that's great. Also, the best practice of doing a phone interview first. And I would like to say here at MAG, we also do that. We kind of reach out and do a first phone interview, and before we bring them in, just to gauge, their interests and make sure that they're here. Um, we want to retain all of our staff. So thank you for that. Also, again, a lot of you touched on the sanitation of your vehicles. It's still important during this time, and we want to keep ahead of that. And also, a lot of your best practices kind of looked at time management. With Eric, with having the tire, I don't know what you call it, the compressor thing available, so it's easy accessible. But now you're thinking of moving on to now looking at the best practice of the discount tire strategy that Belly had mentioned. So, there's information of, maybe if you're a smaller agency, that might be, something that is doable. And then later on, you can move on to working out, like a partnership with the discount tire company or Rio Salado in that the cooking, your cooking program at TCH. Don, thank you for that information. There's so many great things you guys are doing at with your programs to provide to your consumers, always moving the bar further ahead. And this is a commercial that if you would like to share the great things that you're doing at your organization, reach out to Ezekias and I, and we can schedule you for Agency Spotlight. So thank you for that. And thank you to all of our, thank you for everybody here. We know, once again, I've said it throughout this meeting, you are the ones on the front lines providing these services to our consumers. And we greatly appreciate your time that you share with us here today. And we hope that we provide you with information and resources that you can utilize at your agency and take back to your staffing. So thank you, everyone. if you have any questions for me later on, if you think of anything that you'd like to reach out to our presenters, feel free to email Zacchaeus or myself, and we can get those questions to you. Thank you, everybody, for your time, and I will give you back the gift of time. So thank you, and have a wonderful afternoon. And again, yes, thank you for all the work that you do.
Thank you, everyone.
Thank you. Have a good day.